Good morning. Welcome to Talkin Maine with the Bowtie Boy. I'm Tom Saviello. I have my special guest, LeeAnna Lavoie. Married to this guy that's kind of a turkey. No, he's a good guy. Arthur Lavoie. Actually, Arthur and I go way back, literally way back when I was at the mill. LeeAnna, who do you work for?
Thanks, Tom. I work for Healthy Community Coalition at Franklin Community Health Network, and I'm the director there.
And how long have you been doing that? You're pretty new, aren't you?
Yes, I am. I started in November of 2021, but I have a long history of community public health in Maine.
So let's talk a little bit about where did you start at the beginning, coming out of college and so forth?
So I actually went to college here at UMF, and I started as a undecided degree, as you can imagine. And after my second year, I decided to go into the health program, the community health program, which has been amazing. After I graduated college, I did health coaching for construction workers, working with them on weight loss, tobacco cessation, healthy eating, physical activity, kind of the root factors of chronic disease prevention. And then later went to work in a healthcare system doing community public health and really trying to improve the health of the population and the communities that we work in. And I worked at Maine General Medical Center for 14 years doing that, and now I'm working close to home. I'm working in the communities doing very similar work at Franklin Community Health Network.
Wow, that's quite a pedigree that you have back there.
Yeah.
UMF graduates, it's done well.
Yeah.
That's good for you.
Thank you.
So what's your favorite part of the job right now? I mean, let me say not now, but in the past.
Yeah. I think my favorite part is, trying to improve the quality of life of the people in our communities. It's a very rewarding job, but we know the evidence and the interventions and the policies that really help people be successful in their health and in their overall life. It's hard work, and not everyone agrees on how we should do that, but it's very rewarding. And to be in Maine in a small community, the public health community is small, we all know each other, we all work together, so even from across the state, we learn from each other, and I think that's really important.
Growing up, my mother was a public health nurse.
Oh, great.
She had her nursing degree and was a public health nurse until I was about 5 or 6 years old, and later she became a school nurse. So I do the importance of that, and I know that that's one of the bills that my good friend Senator Carson put through would get more community health nurses out there, so that public health nurses, because there were none, or almost none.
Right.
And has that number come back up again?
It has come up. Actually, I worked at Maine CDC for a short stint in between all of that, and we, under the leadership of Dr. Shaw and Governor Mills, they really built the public health nursing program. Sometimes it's hard to find people, but and that's something we're seeing across every job category.
So now you're with the coalition.
Yes.
So tell us what that is, because some people will not remember. I was telling you years ago when Nate was there, we did a show. We actually got on the bus or got on the van itself. But who are you, and who sponsors you, and where are you located? So let's just start with that general kind of conversation.
Yeah, great. So our community coalition really looks at what are the needs of our community, and the Farmington Healthy Community Coalition is the longest standing coalition in Maine. I think that's important to know. And we focus on primary prevention activities, so that an example of that is tobacco cessation, substance use prevention, obesity prevention. Those are some of the primary prevention activities that we do. But it goes beyond that to what are the factors that impact our health, social needs that we're working on, social determinants of health, which poverty impacts health. We know that access to care. We're in a very rural county, and getting access to healthy foods, access to health care, access to physical activity opportunities. That's a big piece of what we do. And just really, again, trying to improve the health of our communities through lots of different initiatives. We also partner closely with the healthcare system and our community partners. So it's one of these things where we're not in it alone, and we really need to partner with all of the community agencies trying to make a difference. For example, United Way, Western Maine Community Action Program, the Children's Task Force, all of these community organizations that are working from birth to death make sure people have the opportunities to be healthy. We are predominantly funded by federal grants. We write a lot of grants. We have a few big ones for COVID and community outreach, community paramedicine, again, trying to get these services out to the rural communities. We have SAMHSA grants, and we also have state grants, and the healthcare system provides some funding as well. So if you think of, we do some direct service programs where we provide chronic disease self-management, prevention programs, provide people with actual information and things. And then we have policy work that we do. So we might work with businesses on, what are your tobacco policies, your physical activity policies, substance use policies. We work with schools and child care centers on policy things that can, again, help promote health. So we have the lens of health in every policy. So when we make a policy, are we thinking about the health of our population? And that's kind of what we bring to the table. And we provide technical assistance to these organizations to do those things.
So suppose I'm one that needs a little bit of help with my diet.
Yes.
My don't laugh now. And I want to reduce my obesity or I want to lose some weight. Would I come to you, to your office? How would I do that?
Yeah, that's a great question.
It's true. I want to find out.
You do. So right now, we do provide Cooking Matters classes, which is a 6-week program where we teach people how to cook healthy food. We teach them the skill. There's a whole generation that doesn't know how to cook, just from scratch. And so we have Cooking Matters programs. But one of the things that we're building is a community wellness center and a teaching kitchen.
I know about that.
You do?
I'll tell you about it in a minute. You probably don't know what we're going to do in your kitchen, do you? But
no.
I'll let you know.
Well, I got to get funding to build it first. But we are working on building a teaching kitchen and a community wellness center where we're going to have more programs where people can come in and learn more about how they can take care of their health and eat healthier. And it's not going on a diet. It's really, how do I just do better and small changes over time? Because it's hard to be healthy, so it's kind of we're going to be building this program. So there's not a lot of ways to get in touch with us as far as signing up for a nutrition class, but we're building that. But if people are interested in healthy eating, I definitely would have them reach out. They can call us or email us, and I don't know if we're going to put that up on there.
We got it. Actually, if you look right here, come here. LeeAnna, right there. See,
yes.
It's running right across the screen. And it says, for more information, call 779-29, is it 2924?
Yes.
And then it's got HHC, mainehealth.org.
Perfect.
It's right there. Can't you see it?
I see it. Yes,
now
I
you see it.
I do see it.
I meant to tell you that. That runs right across. And that would be the way to get in touch. So if I was interested, I could call that number and say, hey, what can you help me? Or who can I talk to about coaching?
Right.
It's not so much eating. It's about I eat too much and I love ice cream.
Yes, I love ice cream too.
And I love beer too, so that was the other problem.
Yeah, we should talk after.
So just so you know, your cooking kitchen.
Yes.
So this guy named Trampus, do you know him by chance?
Yes, I do.
Well, we're going to do a cooking show together.
Oh, you are?
Oh, yeah, we are. We're going to get somebody who really knows how to cook to make something, and the two of us are going to be the assistants.
Oh, I love that idea.
And we're going to see who gets more flour all over them when they come out of there than the other one. And I've actually talked to one of the chefs that owns Salt and Pepper, Mary Bean.
Yes.
I think she might even come in and cook.
I love her.
Yeah,
yes.
She's always expressed an interest in doing that.
Okay.
We've actually had a cooking show on here twice.
Really?
Father Dumais from the Catholic Church came on, and we made ploys one time.
Okay.
And then Cynthia Standikoff came on from Chesterville, and we cooked mushrooms.
Wow.
So I'm ready.
Okay, well,
ready to go.
We are working with the architect.
You're so right about that. There's a generation, appears to be, that doesn't know how to cook.
Yeah.
And not that they don't want to know, they just are never exposed to it. So, and they don't know how they can take a can of tomato sauce and stretch it into a number of different things.
Yes.
And that's something that I think will be very successful.
Yep.
You're also putting a food cupboard in too, if I remember correctly.
Yes,
or maybe that's already operating.
So we do have a food pantry that's specifically for our patients right now. At some point we do hope to expand that. But that is currently where our office is, across from the hospital, but we're moving it over to the hospital, with this expansion of this wellness center and the teaching kitchen. And the wellness center will also provide other resources. So if people need help with transportation, access to care, signing up for the ACA, we provide those types of services as well. So it's kind of like, we're hoping it's going to be like a one-stop shop within Farmington, but then also our mobile health unit will have similar services, so we can bring that out into the more rural communities.
Well, save that thought for a minute. Let me go back. So how has Medicaid expansion helped? Has it helped with you guys and the job that you're trying to do?
Yeah, absolutely. Access to health care is critical. And, for us to be able to, and I don't know the data, but I know that we, for Franklin County, we have increases in people who have coverage now. And people are so thankful when you help them sign up for the ACA or even any benefits, not just health insurance, but if we help them with any benefits, SNAP Ed benefits, those types of things, people are super helpful because it's overwhelming. Yeah. And to have a person that can walk them through, they're very thankful. And we have funding that helps with that.
And you're able to do that through your organization?
Yep, we do that through our organization.
Back when I was in the State House, I was one of the few at that time of one particular party that continually supported this, because what I realized, we were paying for it anyway. That was the argument. Why should we pay? But what we're paying for is when that patient has something bothers them in their stomach, they don't get it checked out. Then come out to find out it's some kind of cancer. So now we're paying $100,000 when we could have paid $10,000 to have it corrected right at the beginning. That was so important to me personally to see that happen. I was fortunate. I always had health insurance, but I knew that someone else doesn't. So it's good that you've been able to expand that and help people, because it is complicated. Unfortunately, it's very complicated to do that.
It is complicated.
So what are you doing around COVID in New York? Because you and I talked about just before you came on the air. I've had all my shots.
Yes.
I even had a rabies shot in case I bit somebody. But at the end of the day, you had this powerful ad that was on the radio this morning. There's a gentleman from New Sharon who tells his story of saying, I don't need the shot, I don't worry about it, and then he got taken down by it and is still 2 months away from recovering and still can't go back to work. What are you guys doing from an educational standpoint about that? I mean, that's got to be tough to do, particularly in Franklin County.
Yeah, Franklin County has one of the lowest vaccination rates. You probably know this, and it is tough. We're at a point where if you're going to get it, you're going to get the vaccine. But we're really working on trying to understand why people are making a decision not to get the vaccine, and part of how we're doing that is talking to people who decided initially not to get vaccinated and then changed their mind, and to get at what happened, what was the shift. And Sean's story is a great one. He's, I'm healthy, I'm a farmer, I work at a mill, I'm young. If I get it, I'm going to be fine. And he wasn't fine. And it impacted his ability to work, impacted his family, it impacted his financials, and he has lingering health issues today. And it's probably more like 3 months now.
Wow.
And so I think he's finally been able to go back to work, but it's really was an eye-opener for him and his family. And for him to tell his story was really powerful for us. And there's lots of people like that have changed their mind because of something. They've lost somebody, or they were personally impacted by by COVID. So we continue to work on understanding why people are making a decision not to, but then also making sure there's access to vaccines. We have a HRSA grant, which is the Health and Resource Service Administration. It's a federal agency at DHHS, and we receive some funding to provide resources to our more rural communities. And we're doing some market research on what towns have the lowest vaccine rates, and then we're going to go and have conversations with the towns to say, we have these services, we can come with the mobile health unit, we can provide free vaccinations. We also have free test kits, the rapid test kits, and I can talk a little bit more about that. So we can get as many test kits as we want from the federal government. We can give them to employers to give out to their employees. We can give them to community-based organizations. We can also give them out to individuals. At our office, we are every Tuesday from 3:30 to 5:30 are offering free test kits for people.
So every Tuesday?
Every Tuesday.
3:30 to 5:30. If someone wants to pick a test kit up to bring home and have it, just in case, they can stop by your office.
It's a drive-through. We'll come right out. They don't even have to get out of their car. So that is every Tuesday. And then in addition to that, we can give bulk free test kits to organizations that they then can give out to their...
Does a test kit, is it instantaneous?
Yes, it's
so if I do it, I'll know whether I've got COVID or not.
Yep.
It's a rapid. Stop by and get a test kit.
Yeah, that would be great. And we're recommending, if you are going to have large gatherings with people, and specifically indoors, to do this rapid test before you go. It's another way to be safe and make sure that you're not contagious and are positive.
That's got to be difficult, because the thing that we would remark about is once things open back up again, and being a football fan, I would watch both the college games and the professional games, and nobody had their mask on.
Right.
So I was trying to explain to a child why they have to wear a mask.
Yeah.
It was very difficult.
Yeah.
And I think the other thing you guys walked into is the anti-vax movement that is in Franklin County is one of the strongest community areas that were against vaccinations or mandatory vaccinations.
Yeah.
Plus that chip they put into my arm was so big that my arm was like 4 times longer because I stretched it out. I mean, people don't realize you carry a cell phone. They know where you are every day, every 5 minutes, you know. But I will share this one quick thought. I think one of the reasons is that people think this was like a brand new vaccine when it's been in the making for 20 some odd years. That word never got out.
Yes.
And I think the thing that my suggestion you need to work on is, so it's coming back, or something's coming back, and we're going to use similar technology. That technology is not new technology. It's old technology, and we just were able, because we had already done all initial steps, could move right into a vaccine. That's what I think people think. I think I'm the guiney pig. You know?
Right.
And that's
what are the
scary.
long-term effects?
Oh, long-term effects. You know. I had black hair until I got a shot.
Right.
No, I don't think so.
Right.
But I think that's what you walked into.
Yeah.
So with the vans, well, let's talk about the vans. Okay. Now, actually got on I guess it's going to be the old van.
Yes.
And you're getting a new van.
We're getting a new van.
So what's going to be different on it? What are you going to be at? So this van, and I think the idea, just to sidelight, is going to these different communities that is kind of what I've told Tramp is that Franklin Memorial needs to get out into these communities that are out there, because they don't really know who you are.
Right.
Unless they're sick. They need to know there are other services provided. So I think it's a great idea. So what's the van? Tell everybody what the van does.
Well, the van is not here yet, but it is been ordered and on its way. It's smaller than I would say the other one's like an RV. It's really big. I mean, you can't miss it. This is a little bit smaller, and it has space in it that's more like a clinic, potentially. We plan to expand the services and offerings in the new van, and that we're actually doing like a reimagination of our mobile health unit. What is this going to look like? Our primary focus is getting out there and doing screenings and identifying people who are at risk for different things or who need to be connected, and we're going to be the connectors to that. But we're also talking about, can we bring primary care providers out there with us, and maybe do physicals, or expand some of the clinical side of what we're doing. So because we're more community based. We're also looking at expanding a community health worker model, where it's lay people in the community that know the community that can really help work with people to make the connections and be that support person when we're not there. And so, we're kind of revitalizing the mobile health unit as a way to really engage people in their health.
Wow, that's great.
Yeah.
I mean, I know it was big before, so I'm trying to picture doing all these things in something smaller. That'll be a unique experience. Would it be any cost to anybody if they use the mobile health unit?
No, that's another great question, Tom. It's free. It's a free service, and again, we're just trying to get out there and work with people on their health. Again, improving quality of health, helping them access the resources that they need to be healthy. and support them in that.
Wow, I mean, it's a great thing. I mean, because at least at a minimum, if you check somebody's blood pressure and a few other vitals, can be very important as to that individual that they don't know they have high blood pressure,
Right.
Or they have other issues that are going on. And the technology is so great today. You can do a colorectal cancer screening or give them the kit to go home and do that,
Right.
so, which can be huge if someone captures that before it becomes a real issue that's out there.
Yeah.
And then just let them know who you are.
Yeah.
Now, is this van overseas waiting to get over here because it's stuck on the boat, or?
No, it's here. It's just not with us yet.
That's cool.
Yeah.
I mean, we did, and I told you, I did a show with Nate where we actually sat on the van. So when you get the new van, one of the things we can do, maybe pull it in the parking lot here, and I can actually be like a patient that shows up and do all the things you do. That'd be cool.
That would be great. We'll
in fact,
definitely do that.
when I got my shot, Nate, the guys came over and actually followed me around while I got the shot.
Oh, wow.
Did a video of it.
Yeah.
So that was one of the ones. So I just want people to know it's not a big deal.
Yeah.
You know, not to be frightened.
Right.
It's something you can do, and it makes a huge difference. Like I said, I've had my 3 shots, and I seem to be fine. I mean, the second shot knocked me down a little bit.
Yeah.
I felt, but the third shot, it was like, the only thing was there is I got up in the morning, I'm saying, what did I do to my arm?
Oh, my arm hurt too.
It was terrible.
Yeah.
It was like a tight knot.
Yeah.
And I couldn't, I'm saying, what did I do? And then I said, oh yeah, I got the shot yesterday. So what are some of the other things that you guys are doing that we've missed so far?
So there's kind of 3 categories of work that we do. I've talked a lot about one of them, which is chronic disease prevention and management, which is the healthy eating, physical activity, tobacco. We also do behavioral health, and that's mental health and substance use prevention, treatment, recovery. So we have a fair amount of work and a lot of grants to address the opioid epidemic in our county. And then the third bucket is the community outreach and access, which is, again, we talked about the vaccines, the mobile health unit. So those are kind of the main things. The other piece that we're involved with that I think is important to share is we do the community health needs assessment process. So every 3 years, the healthcare systems, Maine CDC, go through a community health needs assessment where we want to understand what are the priorities of our communities, like what do they think? So we can see the data. We know that cancer is our #1 preventable killer in the county, but that might not mean something to someone in Franklin County. But I wanted to share that the recently completed community health needs assessment, the #1 issue is mental health. You're probably not surprised by that.
No, I'm not at all.
Yeah.
Actually, with COVID, but even before that. Not surprised.
Yeah. And so the biggest concerns was availability of mental health service providers and youth mental health.
We don't have the providers in, if I remember correctly.
Right.
You at the hospital have actually had to segregate certain rooms because you have no other place to put these people that are really struggling.
Especially young people.
Yeah.
Yeah. Access to care, so cost barriers, availability of primary care, and then also we're seeing a decrease in community members having a PCP, having a primary care provider. So that's one of the things we're going to be working on from a community perspective, but also a healthcare perspective. Substance use, so our overdose deaths, drug-affected babies, hospitalizations due to mental health has increased, and then adult chronic heavy drinking, alcohol-induced deaths, misuse of prescription drugs, marijuana use. We're seeing.
Has that increased since we've legalized it? Do you know? Have you had
so we don't have recent enough data to know. We suspect it is increasing. We are seeing increases of overdoses in marijuana use, particularly unintentional overdoses in young people, even accidental ingestion, pets, kids, because it's not being safely stored away. So that's one of the messages we're trying to get out there, like make sure you safely store your medications away. And then the last kind of priority was social determinants of health, and that's poverty, adverse childhood experiences, and access to broadband. So those are the main concerns that Franklin County have right now. So what we do with that information is we develop a plan to help address some of those things. And we're working on that right now.
So what will you do? I mean, the opioid crisis is kind of, it's huge, but it's kind of fallen out of focus because of COVID.
Yeah.
So how do you bring it back a focus on that? That's got to be a challenge.
Yeah, well, it is. It's a balancing act because we have to deal with both of them. We're lucky that we have federal funding, so we have staff that are dedicated to work on harm reduction activities. And we're working again with our community partners, and we have, a task force of people that meet monthly to talk about, how do we address these issues? How do we support recovery? We're trying to build our recovery program. We're expanding our harm reduction services like Narcan availability, looking at, a syringe service program in Franklin County. So there's some evidence-based strategies that we're looking at as a team. Recovery, housing in general. I'm surprised that didn't come out. Housing is another issue.
The reason in farming, just as speculation, is one of the things that we never have here, theoretically, according to the feds, is homelessness.
Right.
Because we always find a place they find a place that somebody takes them in. So by definition, we don't have a homeless situation. So when they talk about housing, it's like, well, it's not crisis because we are so kind.
Right.
But we do have homeless people,
We
so
do.
I'm not surprised by that.
Yeah. Homelessness and housing, affordable housing.
And the mental health does not surprise me at all. I mean,
there's a lot of work we need to do.
A lot of work we need to do because people don't recognize what it's out there and they don't know how they can get help. I just thought, can someone get Narcan through your facility? Yes. So same thing, just call a number that's there and make arrangements to come pick some up?
Yep.
Because I think I'd like to have some in my glove compartment just in case.
Yeah, absolutely.
Yeah. Just it's terrible that you'd have to implement that, but it is a lifesaver, and it gives that person another chance to hopefully decide they want to do something.
Yep.
Fentanyl is still a big, huge problem here.
It is. It is.
That's what a lot of people don't understand because they ask, why do we need a police force? We're good. Well, he says, you're not around at night. You don't know what this place really is like behind that. And you guys at the hospital see it of all places that are there.
Yep.
Wow. So we're getting close to the end. So what would you like to leave as a message? You can say hi to Arthur now. Hi, Arthur. I just want to say hi in case you're watching the show. I want to come out for a ride with you. So I want to see that thing that you're carrying now that I helped get that happen.
Right.
Anything you want to leave for a message for the group?
Feel free to reach out to us anytime.
Let's put the number back up again, Andre. Just so
you can call, email us. We also have a website. If you Google Healthy Community Coalition in Farmington, that will pop up. And if you're interested in partnering, if you're a community organization, an employer, and interested in partnering with us, or if you're an individual that needs services, please reach out to us. We can definitely, if we can't help you, we can link you to the resources you're looking for. So,
that's great.
Yeah.
I'm looking forward. I think we should think seriously when you get your van in.
Oh, definitely.
We'll bring it over here one morning in the summer and park it out in the parking lot, and we'll actually do it as if I was somebody that was coming in. Say, okay, I'm here. Let's show me all the things you've got. You can take my blood pressure. You can give me a couple of shots and then have a beer in the back.
I don't know about that.
Well, and Arthur can come and guard us while we're there.
Make sure we're safe. Make sure there's no forest fires.
I want to thank you. This is great.
Yes, thank you, Tom. Thanks for having me.
But I'd like, some of those programs, as you get ready, as you know, Ryan's helping coordinate that. Bring one back in again. We'll talk about it in detail.
Definitely will.
Great. Thanks for tuning in. And you know where you can go for help if you need it. It's right there on our page. And give us a call. Give them a call. I'm sure they'll help you out. We'll see you next time.